Thank you for viewing BIOTONE Professional Massage Products Pep In Your Step treatment video. In this protocol, we'll be utilizing rocking, compression, myofascial strokes, and targeted bodywork to put the pep back in your client's step. Our tools for this particular protocol are Controlled Glide Massage Cream and Marine Therapy Pedi Balm. Our table setup is a fitted sheet, flat sheet, and blanket. We've got our client on the table. We started her in a supine position. And the first step of our protocol is rocking. So what we're going to do is we're going to rock her body. And I want to do that by kind of bringing my hand around her ASIS here and a little bit above the knee here. And I'm rocking. My hands are connected. I'm not jostling her. So I'm not like taking my hands off the body and pumping. And here you can see I'm using my arms to do that. I don't want to use my arms. I want to use my body weight. So I'm going to take one foot in front of the other so that I can rock back and forth from my lower body. Locking onto the hip right above the knee and then rocking. This is going to feel really connected. And then I'm just going to move down all the way to the foot. And then I can come back up. I'm kind of moving a little bit so my pressure here is going upward a little bit, and then I can transition so now my pressure is coming downward a little bit. So you kind of want to do it from different directions and really get connected. We're going to move over and do that to the other side. And now on to our second step, which is compressions. So with compressions, we want to come in and we want to connect with the body. Long, slow, deep compressions, bringing our pressure in slowly. And we're going to compress as deep as the tissue lets us. So as I drop into her here, right about here, I'm bringing my body weight down and in, and I can feel that her body's not letting me sink in anymore. The pressure's starting to come back up into my elbow. So that's as deep as I want to go. I'm just going to kind of hang there, and I'm going to hang for about 10 or 15 seconds. And then I'm going to move down one little piece at a time and repeat and do the same thing. And I'm coming right along the midline, right through the quad. You may feel little restrictions as you do that. As I'm moving down her leg right through here, I can feel tension. So I'm not able to sink in as far. There's a little bit of resistance. So I might hold that a little bit longer to really let my body sink in and to let her body accommodate the pressure. Right. And then I might come in and do a couple of rocks or jostles, just to integrate that. Okay, we're going to move our compressions down the leg now. Anterior tib is on the front. I want to basically come in and spread across the top of the bone, pulling the tissue off the bone. Now you could do this through the blanket, or you could do it directly on the skin. I really want to connect with the tissue, and I find if I do it through the blanket, I don't have as much slide. So I'm really gripping the tissue and pulling it off. That's why I choose to do it through the blanket. So I did one stroke a little faster just because this area can be tender. And now I'm going to come in a little slower with my compressions. This is great for clients who have shin splints or who run a lot. Really opens up the front of the leg and gives a lot of range and motion. We've done our compressions, we've done our rocking. Now we're going to come in with our long elongation strokes. So I'm going to go ahead and drape her. Pull this up into a diaper drape. So there's a couple of pieces that are important. We don't want to just plop down on the client. We want nice elongation strokes. And so we're going to use what's called airplane contact. So airplanes don't land all at one time. They glide in and they glide off. So all of our strokes are going to connect with the body, coming a little farther down than we're actually planning on getting our pressure in. And then as we finish our stroke, we're going to glide off or release our pressure and come off. So it's increasing pressure and then decreasing pressure on each stroke. We're also going to lock and load the tissue. So as we come into our depth, which is moving into the tissue, we also have pressure in a direction moving up, right? So as we connect, we want to get to the depth, the therapeutic depth that we're actually going to hold the entire stroke at. And then we're going to create our pressure toward the head of the table, and we're going to maintain that pressure toward the head of the table at a consistent pressure the entire time. So what that means is I'm going to come in a little south of where I want my complete pressure to be, and then once I connect into the tissue, I'm going to hold it there, and then I'm going to move toward the head of the table. As I'm moving through the muscle, if there's an adhesion, if there's any type of resistance or congestion, I'm going to get stuck. I'm not going to be able to continue moving up toward her head. And that's where therapists, a lot of times, they'll lighten up their pressure or they'll increase their pressure toward the head and they'll push through the tissue. And you don't want to do that. You want to wait for it. So if you're stuck and your movement has slowed, you just hang out and you wait and have the client take a couple of nice deep breaths in and out. And what will happen is as that tissue unwinds, it'll open up and you will continue to move without increasing or decreasing your depth and without increasing your pressure toward the head of the table. So we're going to go ahead and apply our controlled glide massage cream. And I don't need very much of this. Controlled glide, a little bit goes a long way. So for her whole leg, I'm going to use maybe a nickel size quantity. I'm going to rub that in my hands and then apply with a nice long effleurage stroke. We're going to start on the outside of the leg and move our way in. Start with short strokes and then move our way down. So I'm coming in, my depth and pressure is going to be here. So I'm starting my stroke about 2 inches lower. And right at that place, I'm going to lock into my depth and my direction. And so now I have a consistent depth and consistent pressure toward her head. And just wait for it. It's long and slow, so don't be in a hurry. And deep breaths in. And then I'm going to come down just like maybe 2 or 3 inches farther down the leg to begin. I'm going to lock in my pressure in toward her body and my pressure toward her head. Same thing, I'm not working hard here. My pressure is coming from my back leg, pushing off toward the head, and my pressure into her body is coming from me dropping in with my whole body weight. So my arm, none of that's doing any work. It's just kind of hanging out. My front leg is bending and my back leg is lengthening. Come down a little bit farther. I'm kind of moving around to make sure I stay comfortable in my body. Kind of initiate with my elbow sort of locked into my hip a little bit to get the pressure that I want. And then as I start moving, I'm going to kind of move around a little, maintaining that pressure in and the direction, but making sure I stay comfortable and that I'm aware of where my body is in the movement. Don't want my wrist to end up at like a 90-degree angle. You want it kind of more straight so that you don't stretch all of those tissues on yourself and cause yourself injury. And then our final stroke, we're going to start just below the knee. So you can see here, this is where I'm connecting, but my pressure is going to come when the base of my hand. So this is where I'm getting the most depth, is at the base of my hand. I'm just rotating her leg in a little bit to make it a nicer angle for me. You doing okay? It's always good to check in with our client occasionally, make sure that the pressure's not too much. I'm watching her, I'm making sure she's not breathing heavy, that she's not holding her breath, that she's not tensing up anywhere. If she is, I might need to lighten up my pressure. I may be at too great of a depth. So just need to check in with her and make sure she's comfortable. So we're going to repeat that movement, moving inward slightly. So I'm going to start at the top again, get my depth and my pressure, and just let our body pull me in and let the tissue and you can see the speed here. It's much faster. There's not as much congestion. That's because the IT band, which is on the lateral part of the leg there, tends to have a lot of tension in it. So you're going to usually move pretty slow through that tissue. And then depending on who your client is and where they hold their tension, you know, you'll find it. Bring the leg into a bend and slightly to the outside, and then come in from this direction here. If you choose to do that, just be aware, like right here's the groin, so you can take the blanket and tuck it in really good. And then, or you can even have your client come and bring their hand and just kind of rest it at their groin. That'll make them feel comfortable. They'll know where the boundary is. Because I may want to take this stroke right up into the lateral side of the pubic bone. If I have an athlete or someone who runs, or a hockey player, ice skater, that type of thing, the attachments come all the way up into the pubic bone, and coming in that deep, it's going to be a more complete stroke. Now obviously you have to have a lot of comfort with your client. You have to communicate with them, make sure that they're okay. And you could do this with 2 hands as well as just 1. Fingers can be a little much. They're very pointed. So I'm kind of trying to neutralize them by flattening them out a little, but I could just as easily use the side of my hand instead. And right there you can see my hand is completely stopped moving. I'm kind of stuck in that tissue right there. I'm just going to hang out and wait. Take a nice deep breath for me. Oftentimes that's all it takes. 1 nice deep breath and you'll start to move again. So once we've finished our sort of segmented strokes, we're going to come in and just do a couple of long full body or full length of the leg strokes here, and with a little bit of greater depth. We've sort of are peeling the layers of the onion. We've come through the superficial, and now we're going to come in with a little bit more depth. Great. And now we're going to do the same thing, lower leg. I'm starting with my fingers in a little spread, just to kind of open the tissue gently, and then I'm going to use the flat. And it's exactly what we did on the upper leg, and we would continue that through all the way down to the ankle, and then the inside of the leg. Same thing, if you need to bend, you can, or you can keep it straight leg and just roll it to the outside a little bit. And then we come back in and do a couple of those elongation strokes, just like we did on the upper leg. A little foot pull. And then if there was any areas that we felt, and on her, the most congested area I felt was kind of right here through the middle of the quad. So I'm just going to come and feel where I felt a little trigger point, and I'm going to just do a little bit of targeted body work now that I've opened up that superficial tissue. Am I on it there? Right, and so I'm just going to drop into that point. Trigger points, you want to find that specific little spot, little grain of sand, little piece of rice, it feels like almost in there, and compress down into it. Take a deep breath. On a scale of 1 to 10, what would you say that level is? 10 being like pain and 1 being nothing. 5, okay. Therapeutic level is about a 6 or 7. So what am I at there? Okay. I just increased my pressure a little bit to a 6. I'm going to hold that for 6, 7, 8, 10 seconds until I kind of feel it starting to release. And there it goes. And after it releases, I'm just going to do a little petrissage, some effleurage, and I would repeat that any places that I felt necessary through the anterior part of the leg here. We do the other leg, and then we're going to flip her over into a prone position and do the posterior side. So we flip the client over into a prone position, and I want to do my first step, which is rocking. So again, I'm going to connect. I'm going to get one foot a little in front of the other. I'm going to connect with the body right at the top of the hip on the sacrum, and then at the lower leg, and I'm going to rock. And again, the rock is coming from my legs, my knees bending, and rocking from my back foot to my front foot. And I'm going to move that down, and I can switch my feet. So now I've got my pressure is moving toward the head of the table more compared to if I switch my feet with my opposite foot forward, it's coming more toward the bottom. So you can kind of shift depending on where you're trying to get the pressure from the rock. I'm going to bring that all the way down the leg. And then we would go over and rock the other side. After rocking the other side, come back over here, and we're going to do some compressions. So starting at the top of the hip, I'm going to use my knuckles, and I'm going to wrap around the sacrum. So I'm going to kind of match the lateral edge of the sacrum. I'm going to get my belly button in the direction of my pressure. My feet are facing the same direction as my pressure, and I'm going to drop in. Slow, deep increase in the amount of force into her body. And I'm going to hold that again for 10, 12, 15 seconds. Now I'm going to shift. I'm going to bring my belly button facing this way. Wrap my knuckles a little lower around the sacrum. And the same thing. Pressure on the back foot, moving toward the front foot. Slowly increasing the pressure until I feel it pushing back into my body, not letting me sink any deeper into hers. And I'm going to wait and hang out 10, 12, 15 seconds. So I have her sacrum here. So that's the edge of the sacrum. My knuckles are right along that edge. All right, so as I do those compressions. Now, if it's hard for you to use knuckles, you could use the back of your hand. You could use your elbow. Whatever's comfortable for you. It's not about what tool you're using, it's about the intent of what you're doing. And in this case, our intent is to really connect with the lateral edge of the sacrum as we compress and hold along all those attachments. Now I'm going to move those compressions out from the medial to the lateral, coming along all of the external rotators. So I'm just going to bring my knuckles out slightly and compress and hold. I'm going to move a little quicker here, but just remember, I would hold each one of these positions for 10, 12, 15 seconds. It just depends on how long it takes for them to release. For the sake of our video, I'm going to move a little bit faster. I want you to get the idea of the direction of the compressions. And then when I get out here to the very outside along the greater trochanter, what I'm going to do is I'm going to switch to my elbow, and I'm going to come up on top of the tissue and drop my body weight down so that I'm compressing into the greater trochanter. And this is deeply relaxing for the client. Holding them for that long and moving through the tissue, it just, with each breath, they relax and sink into the table more and more. So by the time we actually get to our elongation strokes, they're already relaxed so much we can get a lot more work done and get a lot more depth without having the discomfort that oftentimes comes with it. Okay, so I'm going to come here now, and so now my pressure is right below the gluteal line into right there, those attachments of the hamstrings into the sits bone. Again, I'm using my fingertips, but you could just as easily come in and use a knuckle or an elbow. My pressure is this way, So I'm going to take my legs, my left leg is here, my right leg is this direction, and my pressure's coming from pushing off of my left leg toward my right leg. So all of this is very relaxed and I'm comfortable. It's just dropping in and then pressing off that hind leg. She's got some little twitches going on in there as that releases. Deep breaths. You can see here my hand is relaxed. It's not all tense or tight, it's just kind of hanging out, and that's important because you don't want to hold tension in your body as you're doing these compressions. It just hurts you. You're really just relaxing into it. The same thing, I'm going to move down a little quicker than I would actually do the movement, but I want you to kind of see the positions and how I'm just moving just a few centimeters at a time. Right there, she has some resistance. Take a deep breath in. Try to let that muscle relax. There you go. Good job. So when you feel them tense up or tighten or resist you, just slow down on the speed of putting the compression in and wait. Have them take a deep breath. Have them bring their mind to that muscle and say, okay, tell that guy to relax. It's okay. You may even need to come out a little and do some jostling or some totement, and then come back in with your compression again. And my pressure here, I'm just dropping straight down from my chest. And again, if I wanted to do some spreads in that tissue, I could bring my hands, cross them, get myself centered, and drop down. And we would continue that movement down the leg. And then coming into the calf here, I want to be careful. I don't have a bolster underneath her leg right now, so I don't want to press too hard here because it's gonna flatten her foot out. So you can either add a bolster, which is what we're gonna do, or you could put a pillow or put your knee up there and have their foot rest on your knee. It kind of just depends on what your client's comfortable with and what you need to do. So now I can compress, and I know I'm not putting a lot of stress onto the front of her ankle. It was a little uncomfortable for me. My hand was coming too much into 90 degree, so I switched into a fist. And there's a lot of tension right here, so I'm going to switch my compression to just my fingertips. I'm going to double up my fingertips so that they're protected, and I'm just going to get a little more pinpoint pressure into that area of congestion right there. Are you all right there? Okay, take a deep breath in and out. And it's starting to release really quickly. And then I'm going to go back into the same, into my fist. And then we would work all the way down. Okay. At that point, we're going to undrape and do our elongation strokes. So I've draped my client in a diaper drape. I pulled the sheet up, and what I did is I took this little edge of it and I gave it to her so she can hold it in her hand, because I've got her whole glute exposed here. I want to be able to get all the way up through the sacrum and the top of the iliac crest. So she's got that sheet. If while I'm moving her, if I move her leg or whatever, if she feels like there's a little gap or this isn't tight around the inside of her groin, she can just pull that sheet, and that's gonna maintain that sheet as being tight around the inside of her thigh. Gives the client some control and some sense of safety to know that they're covered there. All right, and so I'm gonna apply my controlled glide massage cream. Same thing, just about a nickel size amount. We don't need very much. Controlled glide is designed to go on with a nice effleurage, but then it's gonna absorb into the body and it's gonna give a lot of stick. And the benefit is that I can still really grip the tissue and get good lift in it without gliding too much. And it's just designed perfectly to be able to do this type of work where we want to connect to the tissue and do nice long strokes. So once I've got that applied, I want to come in and I want to do the same thing that we did on the anterior part of the body, feed the tissue in toward the bone, working our way out. So because on the front of the body, all the muscles basically are running, for the most part, longitudinally. We just did straight strokes. But in the glute here, we've got all the external rotators and whatnot. So we're gonna do our movements in toward the sacrum first and work our way out to the outside of the leg. And then we're gonna come up the IT band and work our way through the midline. All right, so I'm starting high in the hip, and I'm just using my fingertips, and they're doubled up. And I'm gonna airplane contact in and connect. And bring that right in to the sacrum. So if you can imagine, this is her sacrum. I'm coming in through the tissue and pressing into the lateral side of the sacrum and working my way down the sacrum. And then we're going to come a little farther out and move in further. So if for some reason that's hard on your knuckles or straight fingers, you can also come in with the side of your hand or your elbow. Deep breath in. If you're going to use your elbow or the flat side, you're not really using the point of your elbow, you're using this flat edge here. And if you start with your hand in a down position, you can connect and then rotate your hand, and that'll actually bring the tissue up. It'll lift it up into the bone, and it'll give you just a little extra oomph in your stroke. You okay? She's a little resistant. She's tightening through the glute a little bit. So take a deep breath for me. I'm going to wait for her. Again, my hand is relaxed, my arm is relaxed, my whole body's relaxed here. All right, move your leg around, wiggle your toes if you need to. Just kind of take a deep breath. Is that pressure too much? Okay. And now I'm going to do that rotation, which is going to give that little bit of extra lift. It's very important to remember to wait for your client. For the lower part of the glute here, I'm going to actually switch my position and come in with my opposing arm with my pressure again toward the sacrum. And rotate my hand for that lift. So I'm going to move my way out. Using your elbow, you're going to get a lot of tissue. You're going to connect a lot, whereas your fingertips or the back of your hand, it's going to be a smaller area that you're going to connect with. Each time I come in through her glute, she initially tightens, so I know that's going to happen. I can tell. It's pretty consistent. So I'm going to make sure I come in with a lighter touch, sink in more slowly, wait for her to relax, and then initiate. Okay, take a deep breath. Right, glutes can be very sensitive. So you don't want to come in hard and fast here. Nice, slow, deep compression. She's got a lot of twitching going on, so I'm going to wait for that twitching to stop before I change anything. I'm going to wait for it. Now another thing that I can do here, in combination or just by itself, is bend the leg up and rotate it to the inside. And what this does, if you can kind of imagine my arm here, this is her greater trochanter and here's her sacrum, right? If I rotate her leg in, it's bringing that lateral edge of the greater trochanter toward the lateral edge of the sacrum, which is going to shorten all of the external rotators and all of the muscles through her hip. So by doing that, I can bring her leg into the inside, and then I can take my hand and I can lock and load with my pressure toward her sacrum. And as I hold that there, I can rotate her leg toward the outside slowly. So by doing that, again, here's the sacrum, here's the greater trochanter. Those muscles are shortened, and I lock into it. Then, as I rotate her leg back out, I'm lengthening the muscles, but the attachments are anchored under my hand here. So it's really going to give a lot of stretch and pull, but it's a very gentle way to do it. So leg in, connect, pressure's coming off my hind foot, and then bringing her leg to the outside. Scooch down. So for somebody who's really resistive or has a hard time letting you move their body, this may not work. For someone who's really sensitive through the glute, but they don't have a hard time letting you move their leg, it could be great. So you just kind of have to play with what works for each of your individual clients. I'm going to move a little bit more lateral. How does that feel? That was a great. And it does tend to feel very good. All right, and here I'm coming in actually on top of the greater trochanter, and I'm holding down into the trochanter as I rotate off. All right. Then we can cover her glute up, and we're going to do our movement starting lateral. Remember, coming in just a little bit lower than where you're actually going to lock and load your pressure into the base of your hand. So I'm coming with my fingertips, getting a good position, compress in, lock the tissue at that level, and then I'm going to start loading it as I move toward the head. And I'm going to repeat that all the way down the lateral leg. Getting myself, and you'll see me, I'm just kind of moving to find the right position for my body. Every client's a little different, so, you know, and your table height matters a lot when so you have to make sure you get yourself in the right position. To get this lateral part of the leg, it just feels like it's going to be more comfortable for me to move into an elbow. So I've got a really wide straddle stance here. I'm going to lock in and then push off my back foot toward the head of the table. And I get stuck right there. She's just not moving. Got a steady pressure in. It's consistent the whole stroke. Steady pressure toward the head of the table. And I just stop because the tissue's congested there. So you take a nice deep breath for me. And out. We just wait for it. If it absolutely won't give, if you're there 20-something seconds, you might need to lighten up your pressure a little bit, or come in and do some jostling, some compression, something to kind of break it up a little bit, and then come back in with your stroke. But I'm starting to move a little now. And I'm going to bring that all the way over the glute to the top of the hip. You can also bend the leg a little bit. So you're having a hard time getting to the lateral side of the leg. You can just bend it. That's going to expose it. And then I'm going to finish up the second quadrant here. And there's quite a bit of congestion through here. So you might also want to come in and do a few push-pulls. So with push-pulls, I've got one foot in front of the other, hand on the inside, hand on the outside. And as I bring my weight onto my left leg, it pushes me up. And I rotate back onto the right leg, which pulls my right hand. So, and then I alternate that. So it's as I bring my weight from my hind foot to my front foot, one hand is coming posterior and the other is moving, or I should say medial, and the other is moving lateral. And that's going to kind of lift and pull the tissue. All right. And then the same thing through the calf. Starting on the lateral. Coming to the medial. Each stroke kind of gets a little bit, now that we've done our clearing, now when we come back and do our elongation strokes, each stroke gets a little bit deeper. And then we can integrate all the way up the leg, coming from the calf, all the way up into the hip. Now, we've done our rocking, done our compression, done our elongation strokes, and we want to come in and do our targeted body work. So as you were doing that, you would have felt wherever the tension was. On her, there was a lot of congestion just kind of right at the base of the ischial tuberosity, through the lateral side of the glute, kind of like in where glomerulis would be, piriformis, and in the calf, kind of toward the top of her calf here. So what I'm going to do is I'm going to start high and move low. I'm going to bring her leg up as we did before, and I'm going to come in and I'm going to find that point that I felt earlier, right? Does that feel like I'm on it? Right there. I'm going to slowly compress in. I want you to tell me on a scale of 1 to 10, what's the depth of that pressure. I'm right at a 7, which is my therapeutic level. I'm going to hold it, again, 7, 8, 9, 10 seconds, whatever works. And I'm going to feel for the tissue to start to twitch maybe, or soften. And I'm kind of I'm moving my elbow around. As I feel it release, I'm following the tension a little bit. And then I'm going to hold that and bring her leg in and out, just kind of rotate it. And that's just to kind of integrate those strokes that I just did. I could also come in and do just a little bit of jostling. So for that area at the top of the thigh where I felt her really congested at the base of the ischial tuberosity, I'm going to feel with my fingers, right? Does that kind of feel about? It's a little bit lateral. She kind of chuckled a little, which will happen. Your clients are like, how did you know? How did you feel that? I don't know, I just do, right? And so do you. So I'm going to connect in with that, and I'm going to bring my pressure up toward the ischial tuberosity. I'm going to kind of widen my leg stance a little so I can have a lot of range in where I put my body. So we might do a few of those. And then here on the calf, where I felt that congestion, you have soleus and gastroc here, and they sort of separate. So what I'm going to do is I'm going to kind of pinch. I'm going to come right into the center of the calf there, and I'm going to pinch and pull. You can even lift the leg up and do exactly what we were doing before, but now we're going to pump the foot. Right. Feel for any particular points. And that pretty much did it. It softened up some. All right. So now to finish off our treatment, we're going to get a little marine therapy petty balm. Just need a little tiny bit of this. You can see it's just a little bit. Basically going to do the same thing along the foot. So I'm going to start with some compressions. And you can do these even bending if you have, especially if you have a hydraulic table and you can drop your table down low enough. You can come in and hold the foot up and compress down from this position, which is going to get you a little bit of calf stretch as well. It's kind of nice. Or you can come to the bottom of the table using your bolster. I'm going to get my bolster so her foot's really rested on there, and I can do my compressions that way. And I'm going to do my elongation strokes. What I'm going to do is I'm going to pull down toward the foot on these. So I'm going to start close here and pull down toward the foot. Depending on your comfort level, you could also come from this side here. I'm using my fingers just because it's such a tiny area, but you could totally use your knuckles. Gonna work around the heel. Maybe do some toe pulls. And then I like to bring the foot up into this position, kind of like we did the calf, and curl the toes over. And then I'm going to take my fingers and do spreads from the center of the foot out. I'm going to go and I'm going to do the same thing to the other leg. And after we do both legs, you may want to do some more rocking compressions or maybe some stretching, do some low body stretching. You would never want to do this type of work on the low body and then do nothing on the upper body. So you want to make sure you integrate. So after this session is over and you've done both legs, you're going to take at least 10 or 15 minutes to do some long strokes down the back, some compressions along the side, maybe bring their arms up over their head, cross body stretches. You just need to integrate the upper and the lower body. Don't do this detail in the lower body and then leave the upper body just wondering what happened, right? It's going to feel very lonely. So, and then you'd probably want to see them maybe 3 to 5 days later and do the same type of work to the upper body so that you can integrate it piece by piece. Okay? Thank you so much for joining us, and I hope that you find this video helpful. Be sure to visit BIOTONE.com if you'd like to purchase this or other products. In this particular treatment, we used Controlled Glide Massage Cream and Marine Therapy Pedi Balm. You can also scroll to the bottom of the page and click on the treatment protocol link to view this and other protocols.